Morning, my name is Karina Timmermans. My partners were McKenna Koima and Abby Vetch, and we did meningitis. What is meningitis? Meningitis is an inflammation of the fluid and membranes surrounding your brain and spinal cord. Most cases of meningitis in the United States are caused by a viral infection, but bacterial, parasitic, and fungal infections are some other causes. Some cases of meningitis improve without treatment in a few weeks, but others can be life-threatening and will require emergency antibiotic treatment. Symptom. Hold on. My notes are like off with the slides. I'm not sure why. Like it's symptoms and assessments. That's the notes purpose.
Do you want to grab your computer?
Sure. Sure.
I think it's matched up here actually. I'll just make this slide bigger for you. So this one just shows the next slide that's popping up. So just look at this slide over here and then your notes will pop up.
Okay.
Just for
Sorry.
people who are extra prepared. No, that's okay.
Thanks.
Alright, we'll just restart.
Okay, there you go. Risk factors. Skipping vaccinations. Risk rises for anyone who hasn't completed the recommended childhood or adult vaccination schedule. Age. Most cases of viral meningitis occur in children younger than 5. Bacterial meningitis is common in those under age 20. Living in a community setting. College students living in dorms, personnel on military bases, and children in boarding schools and child care facilities are at greater risk of meningitis. This is because the bacterium is spread through the respiratory route and spreads quickly through large groups. Pregnancy. Pregnancy increases the risk of listeriosis, an infection caused by Listeria bacteria, which may also cause meningitis. Listeriosis increases the risk of miscarriage, stillbirth, and premature delivery. Compromised immune system. AIDS, alcoholism, diabetes, use of immunosuppressant drugs, and other factors that affect your immune system also make you more susceptible to meningitis. Having your spleen removed also increases your risk, and anyone without a spleen should get vaccinated to minimize that risk. Symptoms. Early meningitis symptoms may mimic the flu. Symptoms may develop over several hours or over a few days. Possible signs and symptoms include sudden high fever, stiff neck, severe headache, headache with nausea or vomiting, confusion or difficulty concentrating, seizures, sleepiness or difficulty waking, sensitivity to light, no appetite or thirst, and skin rash. Viral infections are the most common cause of meningitis, followed by bacterial infections and rarely fungal and parasitic infections. Because bacterial infections can be life-threatening, identifying the cause is essential. Meningitis can also result from non-infectious causes, such as chemical reactions, drug allergies, some types of cancer, and inflammatory diseases. Prevention. Common bacteria or viruses can cause meningitis, can spread through coughing, sneezing, kissing, or sharing eating utensils, a toothbrush, or a cigarette. These steps can help prevent meningitis. Wash your hands. Careful hand washing prevents the spread of germs. Teach children to wash their hands often, especially before eating and after using the toilet, spending time in a crowded public place, or petting animals. Show them how to thoroughly wash and rinse their hands. Practice good hygiene. Don't share drinks, foods, straws, eating utensils, lip balms, or toothbrushes with anyone else. Teach children and teens to avoid these items as well. Stay healthy. Maintain your immune system by getting enough rest, exercising regularly, and eating a healthy diet with plenty of fresh fruits, vegetables, and whole grains. Cover your mouth. When you need to cough or sneeze, be sure to cover your mouth and nose. If you're pregnant, take care with food. Reduce your risk of listeriosis by cooking meat, including hot dogs and deli meat, to 165 degrees Fahrenheit. Avoid cheeses made from unpasteurized milk and make sure to choose cheeses that are clearly labeled as pasteurized milk. Diagnosis. Your family doctor or pediatrician can diagnose meningitis based on a medical history, a physical exam, and certain diagnostic tests. During the exam, your doctor may check for signs of infection around the head, ears, throat, and skin along the spine. You or my child may undergo the following diagnostic tests. Blood cultures. A blood sample is in a special dish to see if it grows microorganisms, particularly bacteria. A sample may also be placed on a slide and studied under a microscope to see which bacteria are present. Imaging. CT or MRI scans of the head may show swelling or inflammation. X-rays or CT scans of the chest or sinuses also may show infection that may be associated with meningitis. Spinal tap. For a definitive diagnosis of meningitis, you'll need a spinal tap to collect cerebrospinal fluid. In people with meningitis, the cerebrospinal fluid often shows a low glucose level along with white blood cell count and increased protein. Treatment. The treatment depends on the type of meningitis you or your relative has. Bacterial. Acute bacterial meningitis must be treated immediately with intravenous antibiotics and sometimes corticosteroids. This helps to ensure recovery and reduce the risk of complications, such as brain swelling and seizures. Antibiotics cannot cure viral meningitis, and most cases improve on their own in several weeks. Treatment of mild cases of viral meningitis usually include bed rest, plenty of fluids, over-the-counter pain medications to help reduce fever and relieve body aches. Your doctor may prescribe corticosteroids to reduce swelling in the brain and an anticonvulsant medication to control seizures. If a herpes virus caused your meningitis, an antiviral medication is available. If the cause of your meningitis is unknown, your doctor may start antiviral and antibiotic treatment while the cause is being determined. Follow-up. Prognosis of meningitis depends on the cause. Untreated bacterial meningitis has a very high death rate. Even with appropriate treatment, the death rate from bacterial meningitis is about 15 to 20%, and it gets higher with increased age. Patients who survive may be left with long-term disabilities. These are deafness, blindness, seizures, paralysis, impaired mental status, and loss of limbs. Viral meningitis, on the other hand, is associated with a very good prognosis and generally leads to a full recovery. That is all. If you have any questions, let me know.